So good afternoon, everyone. So whoever is present. So my name is Dr. Anna Abramowski. I'm a Chartered Counselling Psychologist, and I'm the founder of the North London Psychologists Clinic, which is an independent private practice situated in Stanmore Bushy Heath, so in London, for those of you who might be joining in the other offices of CyberDuck. And this afternoon, I wanted to talk to you a tiny bit about mindful meditation during this COVID-19 global pandemic crisis. So I'm sure that some of you who are joining us either practice mindful meditation or have done this before. So this is just kind of a test, kind of a taster for those of you who've never heard about it or who've never done it. I just wanted to give you like a bit of a taste of what it's like as a way of dealing with, as a coping strategy for this very difficult testing time. So just a little bit about myself before we start. So as some of you might know, so I'm Danny's wife, and I, aside from being a psychologist here, I lived in Canada, and I'm originally from France. So I've trained internationally, and my area of specialty is in chronic health conditions. So I work as well at the Royal National Orthopaedic Hospital, where I specialize in pain management, and that's in Stanmore. Okay, so in terms of right now, so living in a time of uncertainty where I'm sure it's been testing for a lot of you, and with the lockdown, testing in terms of changing roles, in terms of juggling different responsibilities that you might have, or maybe perhaps some of your loved ones or people around you have been affected or contracted the virus. I want to just give you a little bit of background. So we know that the past 6 weeks, the World Health Organization has basically assessed the outbreak of COVID-19 as a pandemic, and that's just because of the rate of infection, the associated mortalities, and have asked countries globally all over to take aggressive and urgent action. And we know that this is only going to lead to people feeling more stress, more anxious, and a lot of uncertainty. Okay, so I'm just going to present a bit, and then I'd love to hear like your opinions, and if you have any questions, I'd love to hear more about the impact or what it's been like for all of you. So in terms of stress, anxiety, and uncertainty, what's really important to remember is that all of us will respond very differently to adversity, to fear, and it's going to have an impact differently. Some of you might be more prone to fear and to stress because you might have chronic health conditions, or perhaps you have already a pre-existent mental health condition, or perhaps because you're classified as a vulnerable person. I know it's none of you. I can see who's here now in the meeting, but perhaps if you're maybe you're concerned about your loved ones if they're elderly or they have chronic health conditions, or let's say you're an expectant parent, and that would also put you in the vulnerable category. And all of this kind of uncertainty, because we know that guidelines, recommendations change, and the landscape is quite uncertain right now. This is obviously cognitively, so our thinking process, this is only naturally going to lead us to maybe catastrophize more. And when I mean catastrophize more is when our brains kind of go into like the what if mode. So what if this happens and that happens, and kind of our primitive, so our limbic brain is hijacked. That's where we might, be perceptive to threat much more easily. And this can lead us to have ruminations and to feel absolutely mentally and physically drained and exhausted. So the important thing is to try to move away from any catastrophic thinking, and instead to bring some focus and attention on the things that you can't and you can't do. So accept that there are things that you won't be able to do, okay? So I also wanted to say something positive, is that often, we associate stress, anxiety, and heightened symptoms of depression. We associate all of this as a negative. it's very important to conceptualize and to remember there's also good forms of stress and bad forms of stress. So when we think about stress, the definition is basically any non-specific response to our body to any demand. And we know that all of us will respond to stress in very different ways. And there are multiple factors that play important factors. So if we look at epigenetics, so our genetic makeup, environment, you might have physiological or psychological predisposition. And when we speak about good stress, so the good stuff, that's what we describe as eustress. And that's absolutely important as, social animals for survival. It's really important that we respond to stress, because that's going to enable us to kind of perceive threat in our immediate environment. Okay, and this is what's going to activate the primitive brain, so the amygdala, which is kind of like the alert or signal in our brain. And that's going to only enable us to stay focused, motivated. And for all of you specifically, the designers or the more creative and who are working in cyber, this will only boost your ability to create. So this is important, that there's also good versions of stress, and this is usually an acute response. When stress becomes like bad or deleterious, this is when it becomes more chronic, and that's going to have an impact on both of your physical and emotional well-being. Okay, so you might start noticing, like maybe with bad stress, you might notice with your work colleagues, maybe their mood has changed, so that's their affect, or maybe their behavior is changing. So maybe they're more withdrawn, or perhaps you can feel that they're more irritable or less punctual. Maybe they're less agile and certain of their roles, and they might be like more fatigued or tearful. So basically you're not performing at your best ability, your best self. And usually a long-term chronic stress, sometimes that can lead to also burnout syndrome, but we're not going to go and talking about the burnout today. I just wanted to kind of present that there's good and bad stresses, and that this is also, you might be more susceptible during this changing landscape. And then we're going to be presenting mindfulness, okay? So when we look at symptoms of stress, and I'm sure this is nothing new to any of you, but I just wanted you to kind of be more aware and more attuned, because you might be experiencing many of these symptoms right now. So in terms of the physical symptoms that you might experience for stress, you might have muscle tensions, more pain, more awareness of pain, more headaches. You might feel overall more fatigued. You might also have like chest pain or heart palpitation. This is quite normal when our stress or anxiety level creeps up. You might have a reduced sex drive, so your libido is decreased. You might have more nausea or constipation, diarrhea. You might have sleeping difficulties, so sleeping too much or not sleeping enough, and just change in appetite, a weakened immune. And we know also that when you have sleeping difficulties, so with good sleep, usually good sleep health leads to good immune health. So that kind of goes hand in hand. Okay, so you might actually have more colds, and right now it might be that actually any cold or any change in any of your bodily symptoms, you might be more, in general, hypervigilant, or just kind of scanning or doing more checking. Okay, so emotional symptoms is you might just be more irritable. You might feel just overwhelmed or frustrated. You might be more prone to negative thinking. And this is going to impact also on your ability to stay concentrated, or maybe your memory, your recall ability. And you might also have, just in general, a lack of motivation and focus. And right now, with obviously also the changing landscape and stress, you might feel like much more alienated or lonely in your experience. So this is what's great with these digital platforms, is it really enables us to stay socially connected and try to kind of combat these feelings. Okay, so I'm sure that what I just presented is nothing new, but I just wanted you to be all aware of some of the symptoms in general of stress, and how our current landscape might reinforce or exacerbate some of these symptoms. So now I want to present to you a bit about mindfulness. Okay, so as I said, I'm sure that some of you are much more, have been practicing for years, or can actually contribute, and I love to hear from the three of you. So it kind of originated in terms of Western culture. The person who brought it to the West is John Cabot Dean. So he was an American physician in Massachusetts who was working with chronic pain patients. And mindfulness comes from Buddhism, from ancient Buddhism. It actually comes from Eastern philosophy. So although it's not a religious practice, we have to give credit to Buddhists and to the origins of where it comes from. And we know from all the research that it really helps. So right now, the evidence-based research has really changed in terms of how it enables us to really kind of focus in the present being mode. So we're going to look at that. The definition of mindfulness, it means to pay attention in a particular way, so on purpose, and to be very alert and present-minded and non-judgmental. So the most important is to stay alert, present-minded, and alert, present-minded, and non-judgmental. So it's really important. So often our mind is extremely busy. We have, thousands of thoughts. It's going in every single direction. I should do this, or what am I going to prepare for dinner? Or we're in the car, we're driving through a village. We haven't realized that we just drove through the whole village and we didn't see anything. Most of what we do, a lot of things that we do it on automatic pilots. So when we practice mindful meditation, it's an invitation to kind of put the pause button and to really be alert and aware. And the important part of mindfulness, so a lot of people think, okay, I'm going to do a bit of mindful meditation before I go to bed. It's going to kind of help me relax, so it's going to improve the quality of my sleep. It's very important that we don't have any misconception that actually when we practice meditation, it's a zoning in. So when we relax, we're zoning out. When we practice mindful meditation, we're zoning in. So it's really important that we actually stay awake. Okay, so it's natural that you might doze off when we start. Believe me, I did as well. That's why maybe like lying on your bed is not the first recommendation I would give you. Like maybe just, if you want to just sit comfortably on your chair. But it's important for you to, whatever comes up, it comes up. So we're not trying to change anything. The important skill with mindful meditation is to create and to foster greater awareness. So however you're feeling emotionally, psychologically, if you're feeling like heightened symptoms of anxiety, or you're feeling like a lot of shame, or you're feeling completely numb, noticing how you're feeling and noticing how you're feeling in your body. So often in our day-to-day, on a daily basis, we just kind of push through. We either completely make abstraction of how we feel physically, whether it's pain or any symptoms that are changing, or we make abstraction to how we feel emotionally. So it's actually a tuning in, and it's very important to have the mind-body connect. And so this is a definition. I'm blabbing on. And another nice quote from John Cabot Dean is that the best way to get somewhere is to let go of trying to go anywhere at all. So with meditation, you're just letting the mind be as it is and know something about how it is in the moment. Okay, so we're not trying to foster any form of change. We're just paying attention purposefully and alert. Okay, and that's really important. And we know that basically the benefits of practicing any form of meditation, okay, is that it really helps us alleviate any symptoms. So when we think about, I'm thinking about all of you guys for work. So when we think about alleviating symptoms of compassionate fatigue or burnout, stress, anxiety, depression, that kind of turns down the volume. So it really helps. So when we look at the evidence base of people who've gone through like MRI machines and changes that we can see in the brain structure, that people who practice, and we're going to speak about how to practice and what to do, that it really helps to alleviate. And that fostering greater self-awareness is only going to lead us to engage in more self-care activities, which is ultimately what we all want. It's very important to structure and to also prioritize self-care activities during this time when you might have lots and lots of roles to juggle. And when we also practice any form of meditation, this also leads to greater job satisfaction and improved overall quality of life. So it's important, this ability, so as I said, to switch from a doing mode, which is what we do, like do, we just pace through, and to kind of shift slightly into just this being mode, which we're not really socialized, to be. We're just always like do, what's the next thing, what's the next thing. We're constantly socialized to be in this kind of doing, striving, competitive mode. So by just being in this being mode, this is going to allow us not only to see our surroundings, but to feel greater connection, a sense of focus, and as I said, creativity or concentration. And this might also make you see like the things around you. So for example, now, even though we've been locked down, we're on a lockdown for the past month, being able to kind of, even like if you go on your daily walk, to be able to just go on a walk and you're doing a mindful walk. So really engaging with your 5 senses. So what can you see? What can you smell? What can you touch? What are the things around you? The changes in the beautiful blossom trees, the birds right now chipping away. This is really like kind of connecting with what you can see in your surrounding, and actually doing a bit of slowing down and pacing down. There's also some beautiful moments to cultivate. Okay, so this is a quote from a Buddhist monk. So he is a Buddhist monk, and he says that we know that the world only through the windows, I can't see now, sorry about that, kind of through the eyes of our mind. So when our mind is, sorry, I'm going to put it on slower. So when our mind is noisy, the world is as well. And when our mind is peaceful, the world is too, okay? So this is really important. It means that also all of us can be looking at the same picture, we can be looking at the same tree or environment or snapshot. We're all going to have different perspectives and different things that we see in our environment. Some of us might be more tuned to certain stressful stimuli or certain difficulties, some of us less. It's important to really think about the perspective taking that we have, and that's really also going to help and be beneficial to our emotional health. Okay, so just before I invite you all, because I want to invite you all to just do like a short mindful meditation, I just wanted to let you know that there's absolutely no right or wrong here. Okay, there's no right way or wrong way to practice mindful meditation. You don't have to be like cross-legged on a pillow and be on a mountain in Nepal. The most important is that you're comfortable. So you can be standing, you can be walking, you can be lying down if that's more comfortable for you. As long as you find it peaceful and relaxing and you have a bit of privacy, that's great. And remember, it doesn't have to be like full meditations or even going, for a full day and you're going on a silent retreat. Even if you just take like a few minutes of your day, 10 minutes would be ideal, and you just start practicing a bit of meditation, and it's going to take time and practice. So the most important is to not give up. There's no right way or wrong way, but it's going to take time and practice to just kind of listen in, to tune in, to really listen, to really foster that greater self-awareness of how you're feeling. Okay, so I want to invite you now, just before I want to hear from the rest of you, I want to invite you to do a little meditation, which is called loving kindness. And this is one of my favorite meditations. Hopefully the three of you enjoyed as well. And so this meditation is called loving kindness. So all you have to do for this meditation is just sit down or lie down, whatever you feel more comfortable, and gently close your eyes. Okay? So gently close your eyes, and I want you to invite you to do this meditation with me. Okay? And then I want to hear how you found it. So in this meditation, I want you to switch from your usual being mode, doing mode, into a being mode, just simply a mode of non-doing, okay? As your body becomes still, bring your attention to the fact that you're breathing and become aware of the movement in your breath as it comes into your body and as it leaves your body. Not manipulating the breath in any way or trying to change it. Simply being aware of it and of all the feelings associated with breathing. And observing the deep breath down into your belly. Feeling the abdomen as it expands gently on the in-breath. And as it falls back down towards your spine on the out-breath. Being totally here in each moment with each breath. Not trying to do anything, not trying to get to any place, just simply being with your breath. Giving full care and attention to each in-breath and to each out-breath as they follow one another in a never-ending cycle and flow. If you have distraction thoughts that arise, acknowledge them. Then return to your breathing. And now I want you to bring someone to your attention for whom you have deep feelings of love. Seeing or sensing that person and noticing the feelings for them arise into your body. It may simply be a smile that spreads across your face, or your chest becomes warm. Whatever the effects, allow them to be felt. Now I want you to bring yourself to mind. Let go of the person in your imagination and keep in awareness the feelings that have arisen. Bring yourself to mind and seeing if you can offer loving kindness to yourself by letting these words become your words. May I be happy. May I be healthy. May I ride the waves of my life. May I live in peace, no matter what I'm given. And noticing the feelings that arise and letting them be as you look within yourself with mindfulness and equanimity. When you're comfortable, try offering loving kindness to someone who supports you, who's always been on your side. Bring this person to mind, imagining them perhaps across from you, and letting these words become your words. May you be happy. May you be healthy. May you ride the waves of your life. May you live in peace, no matter what you're given. And once your feelings flow easily to a loved one, turn your attention now to someone with whom you have difficulty. It's best not to start with the person who brings up the most feelings of annoyance and irritation. And seeing if you can let these words become your words as you keep this person in awareness. May you be happy. May you be healthy. May you ride the waves of your life, no matter what you're given. Notice the sensations and feelings that arise within you, and seeing if you can just allow them and just let them be. And now, bringing to mind the broader community of which you're part of. You might imagine your family, your loved ones, your workmates, your neighbors, and fan out your attention until you include all the creatures and people on the planet. Include yourself in this final offering of loving kindness. as these words become your words. May we be happy. May we be healthy. May we live in peace, no matter what we're given. And when you're ready, I'd like you to bring back your attention to the room. So that was it for me. That was I'd love to hear now from the three of you or the four of you how you felt that was.